So any girl or woman that has a uterus, at some time in her life, she'll begin to get periods. A period happens when the blood within the body begins to form inside the uterus in preparation for a woman becoming pregnant. Once the body determines that the woman is not pregnant, then that little bit of blood comes out through the vagina and the body prepares for the next month.
Periods usually start as early as 9 and up to 15. The period can flow monthly, but it can take up a couple of months, up to a couple of years to become regular. The flow can be light spotting up to heavy bleeding, a heavy flow.
And a heavy flow is usually identified as having anytime having to change your pad every couple of hours all throughout the day and into the evening. That's considered a heavy flow. Most of the time we want to have those pads changed about 4 times a day or so, even if they're not necessarily soaked through. And then one thing we should mention too is sometimes, not very often, but sometimes women will get very heavy periods. And when they get very heavy periods, sometimes you can become iron deficient. And that's something for you to talk with your doctor or your primary care provider about to help replenish the iron that you lose each month.
And most periods last about 2 to 7 days. Again, if your period is going beyond 7 days, that is another thing that you should discuss with your doctor.